Good day, everyone. I'm Aaron McIntosh, Director of Product Marketing here at ActZero. Joining me in today's fireside chat to provide some insight into securing the healthcare supply chain is Adam Mansour, the Chief Security Officer here at ActZero. Welcome, Adam.
Aaron, nice to be here. Thank you.
A quick housekeeping note before we get started for those audience members joining us live today. At the bottom of your screen, you're going to see three important tabs. The Questions tab, which can be used to submit questions during the presentation. The Attachments tab, where you're going to find some links to resources that we drop in here for you, as well as the Rate Us or Feedback tab, where you can provide feedback on today's session. We do welcome that. It helps us improve and it helps us understand how we've met the deliverable that you were hoping to get today. Now, healthcare providers and organizations are highly targeted for their electronic health information, or ePHI. It's more valuable than other types of information and generally attracts a little bit more money on the dark web. Now, it's no wonder that we're seeing escalating ransomware attacks on the healthcare industry. Just look at the breach by Acelion, by the Clap ransomware in February 2021. They were managed by a local service provider focused on collaboration and secure file sharing. They had over 100 clients hit, including a supply chain vendor. They had 25 of which had data stolen. It targeted Acelion's legacy file transfer appliance, or FTA. In the end, Acelion agreed to an $8.1 million settlement in January of 2022. And we know of at least 11 other healthcare organizations who were impacted by that same breach. To manage risk, healthcare organizations are ramping their investments in cybersecurity, but those strategies often neglect consideration for a critical threat vector, and that is third-party risk exposures. So, Adam, what are the key cybersecurity risks affecting healthcare providers today?
I think there's a lot of different SaaS vendors that, sort of incorporate around a lot of the infrastructure that many care facilities or, hospitals and that type of thing are leveraging, right? If you think about healthcare several years ago, right, you sort of have to always maintain that because there are those physicians that they're used to taking their laptop under their arm and they know, how to use the apps that are on it locally. Others, maybe walk around with an iPad, and you may have, a number of vendors that you trust, a lot of things on-prem like Exchange, letting a lot of providers down, obviously, with the number of critical vulnerabilities that it had, as well as software providers that, may bring cloud-enabled remote management tools to the game that are being used by healthcare providers and indeed almost everybody that are essentially going to be a beachhead for a lot of these compromises. So when you think about the landscape in general, we see an explosion, obviously, in the number of SaaS apps, right? As soon as you introduce a new vector like the iPad, you start to broaden the number of SaaS vendors, even local to that system. And then if you start to think about the mobility and the tools you're trying to enable for these, users, everything from VDI, which may leverage the cloud, or, moving Exchange online to a collaborative, surface, right? You start to just see another opportunity for those changes to just manifest as breaches. And so, for most, healthcare cyber practitioners, I think a lot of them would sort of rank that their investment in cyber has to grow because their investment across the board in IT systems and other connected devices has grown. And so, this is likely the number one share of spend for 2023 in healthcare IT. But when you think about where to deploy those dollars, it's very hard to place bets now, different than it was in the past, where people might have a very good understanding of their single data center, computers on wheels, and their hardware basically having to stay up and back up and recovery and things that they're at least able to frame in terms of scope. And now saying, okay, well, the vectors are everywhere. Where's the entry point? Specifically, the supply chain of software and your software vendors that you may not even be aware that you have.
Yeah, there's an interesting point on the mobile as well. I know a recent Imperium study mentioned 60% of endpoints in any enterprise or connecting to any enterprise now are mobile devices. Those mobile devices are being used as ID with multi-factor authentication and other things like that as well. So it's definitely a different critical risk plane with the involvement of SaaS, if you will. So, Adam, how can healthcare organizations really build a strategy and practice for managing those risks?
I think that honestly understanding your risk posture in terms of calculating your incident response in these cases, you just have so much effort tried to be put on, vendor due diligence and things of a critical nature to evaluate software providers before they come in, It's very difficult to really dig deep under the covers for some of those providers. So I think that while those things are going to come up, and we'll probably talk about some of those items a little bit later, a lot of what we're really trying to do is just evaluate the actual risks, understanding if you are going to manage a compromise from one vendor, what does that actually look like in terms of a fallout? What is the communication channels? How do you respond from a technical perspective, right? And try not to leave any vendors out, right? People assume that, if their critical, EHR app goes offline, they've got a backup and recovery to it. But what's the process if your remote management tool gets compromised? What's the process if you have, a SaaS vendor that may be incorporated into your iPads, gets compromised? How do you become aware of that, right? What if credentials through LinkedIn get compromised, right? And so these are all things that you should sort of catalog, because at least then you can start to put a couple of likely scenarios and plans in place, so that you can at least manage the outcome of okay, we've been breached. We know the proper forums to disclose to third parties what's going on, right? And I think that that's a key part of just saying, well, that's how you can build a strategy around it. And then if you think about examples like SolarWinds and Kaseya and other more prominent software providers getting compromised and leading to the downstream companies as a result, like Actelion, suffering those breaches, right? How do you take that knowledge to the rest of the vendors and say, okay, what if it happens here? What if it happens here? What if it happens here? And that's I think a reasonable strategy for IT security practitioners.
Yeah, no, I tend to agree. I mean, we saw the damage SolarWinds has done and continues to do, right? And Log4j, I think it ruined a lot of people's holidays this year. So, there's tons of attacks out there. I mean, we're seeing them all the time, especially against the healthcare industry, as I mentioned. What are some of the predictors of attack that either healthcare providers and their IT staff can look for, or that they may not see unless they have more advanced threat detection services?
I mean, meaningful targets are always, where's your data and what do you use that's critical, right? Like if I was to say what are meaningful predictors of attack, it's where are the better systems to hit, right? I wouldn't care necessarily if you took a USB key out of circulation. I wouldn't care if you took one laptop out of circulation, regardless of who the user is, because I know the restore time and everything has been built around just operational failures for those types of products, right? And then if you look at things like where your critical data is from a file storage perspective, where the critical apps are, it's very easy for you to sort of come back from 3 or 4 or 5 apps and say, okay, those are the critical ones that without these we cease to function. And I wouldn't include things like all of your workstations and things like that. I would say, are there alternatives to that? Or do you fall back to paper and ransomware exercises? You see that happen all the time, where critical systems to keep up to date at least is that paper route if you do have to have survived downtime. And so I think that when you think about predictors of attack, you take the most important elements of your operation and records, and you catalog those, and then you say, okay, what are the likely vectors, right? How could this be shut down? And try not to go through so many different scenarios that have the same outcome, right? Like it's not important all the trillion ways that they can get ransomware, and trying to build your predictor around what's the likelihood. Well, there's 705 ways of doing ransomware on this one. It's 305. Once it happens, how do you recover from it? What are the moving parts that you try to manage within that asset that are there? If it's a SaaS provider, maybe the vulnerabilities and the management of the operating system is not important. But now you have to make sure that as the versions increase, you're applying the security settings from that vendor or multi-factor authentication, right? If you're on the operating system and you have a general purpose database, right, and it's installed on an operating system, you need the right antivirus hardening, everything else. Everything that app does not need to do, it shouldn't, right? And so taking away all those rights makes it a lot harder to leave that operating system vulnerable to attack. And so the more of those things that are not done, the higher the predictor of an attack, right? The higher the impact, the more important, the more that should bubble it to the top of the stack. And so those are predictors. And I can tell you that outside, when we're starting to do research, especially at ActZero, about what's the next attack, right, you need intelligence, right? This is not something that most people can consume themselves. The attack surface changes every 24 hours, right? And if we were going to sit here and say that a healthcare IT or even cyber practitioner with even 20 years experience is going to every 24 hours know and download and test the new version of something like a ransomware or exploit kit that's out there in the wild, or look for their credentials in the dark web, I think we'd be, kidding ourselves to think that was a practical thing to put on there. So there are community providers that you can subscribe to for that kind of thing. They can tell you in a debrief session, hey, here's the next threat that's coming your way. This is what's coming out of these conflicts or these particular attack groups that are targeting specifically healthcare providers throughout the US because of whether it's COVID pandemic scams or, other ways that they're becoming successful. And the truth is that you follow the money to usually calculate which one's the most valuable one, right?
Yeah, and actually for those audience members, so Adam and I had actually had a discussion a month or so back on trade-offs when it came to threat intelligence. So probably a good session for you to go and watch if you get an opportunity. So shifting gears a little bit, let's talk a little bit about frameworks. We're having another fireside chat session coming up in a couple weeks on this subject, but let's talk about it a little bit here now. Is HIPAA or HIPAA high trust enough to measure preparedness?
I think when you look at HIPAA and the security rule, right, you're really talking about NIST 866. If those of you who've never read the whole thing, it's not that long. You do look at it. It's easy enough to understand. Maybe a few hours you can kind of digest the whole thing. Very much around information handling, right? Very much around the documentation and the process and procedures around capturing the systems and governance and personnel and all the other things that you would typically do when you're sort of giving a broad request to people to say secure this information, which for many years was paper and communication and things that were between two individuals, you and your doctor, you and your a professional that was running a specialist that was running an independent scan on you, right? So you look at these things and say, okay, well, technology recommendations don't come very readily across that security rule. And so if you look at it and say, is this a good predictor for how we're going to get hacked, right? And getting hacked is several years old, and the HIPAA security rule is multiple decades old, right? And so when you think about how generic it is and trying to apply that process behavior, in and of itself, it is not a great framework for saying, well, I should structure my cybersecurity around the HIPAA security rule, right? And you have a separate organization that you almost hear every time you hear the word HIPAA, you hear the word high trust, right? And high trust has made a name for themselves as an organization, building a unified framework around building from CIS and other types of frameworks like NIST, different parts of the NIST library, not just NIST 866, and starting to orchestrate this kind of gold standard. And I think they're on their 9th version of this, 9.4 or whatever by the time of this call, probably higher up to 10 by the end of this quarter. If you look at those frameworks, they're really borrowing from others. They're saying you will qualify for the HIPAA security rule, but here are other practices in governance and real advice we can give you around technology that can help you harden against cyber attack. Do I think that that's a framework that is better or worse than others? I think in a lot of ways, just like most broadly designed frameworks, without real practitioner advice, it's hard to follow and it's easy to then misinterpret and not get the value out of it. So, I would change the question to, what are the systems you have? What are the best practices to hardening those specific systems, if we're talking from an IT perspective about cyber, and then applying something like a CIS benchmark against that product and version that will give you the actual real practical click-throughs to these types of things. And I think that's, for IT at least, and most cybersecurity practitioners, there's no way you can get away from technology, right? You have to have an understanding of the technical outcomes that you're trying to ask for, and that makes it very practical. So I would rely on benchmark statistics and try not to go too far above and start to get lost in what is general procedural advice. But of course, no framework is really inclusive of everything. I think we're on revision 2 for the HIPAA security rule. So the concept of, is everything going to stay the same? It takes a long time. They've been on requests for commentary now for much longer, Aaron. I think in conversations we've had than we've even like to admit. I think, Q2 of last year, I was probably talking about this. So, if you look at how long it takes to update, right? We're probably going to be in a very different environment. Given it just, there's new clouds all the time, there's new endpoints all the time, there's new apps all the time, there's new, technology all the time, and work from home and the pandemic, shared services, all these other things are going to impact, healthcare providers in terms of their capacity. We don't necessarily know what's going to come off the ground there, right? You see all kinds of expansion, even in the U.S., of things like Medicaid being proposed. What happens when all of these records sort of blend together with privacy regulation? There's a lot to be sort of conscious of in these frameworks, keeping up to date and being everything you have to do. So I think you're kind of on your own a little bit to do those benchmarks. I don't think you're all the way alone in terms of coming up with what the best practice is, but I think that you have to do a little more research than just saying HIPAA security rule because I'm in healthcare.
Yeah, and I completely appreciate that. And as I mentioned to the audience members, We have another upcoming fireside chat on healthcare security frameworks. And who knows, by then, maybe HIPAA round 2, revision 2 will be out. Things we don't know the exact timeline on that at all. But one of the other frameworks that does get mentioned, especially when it comes to supply chain, is SOC 2. So the question I'll have is the same as the other one. Is SOC 2 enough to measure preparation?
So I think that when you think about the System Organization Controls Audit, right, it was developed by the American Institute of Certified Professional Accountants, right, the AICPA. You usually sometimes hear statements of standards and attestation engagements, right, the SSAE. Sometimes you hear 16, 17. If you got more gray hair, you probably say SAS 70. So it arose by any other name. Like, this is really just talking about a lot of the principles being audited by a third party, right? Because I think a lot of vendors that you do business with are going to make a number of different things. Either contractually, they're going to say, "Oh, we plan to do this." That's absolutely, that's going to write it in the contract. How do you validate those claims? And so just like looking at a company's financial statements where you can put anything on a piece of paper, right? How do you adjudicate? How do you say that this is a valid piece of information, that it's trustworthy? And that's essentially what that, process was intended to do, was to include accountants, certified professional accountants, in reviewing a lot of the evidence that would mean that as a service provider, when you write something down in contract, that you actually have done what you say. And so it's a validation of a lot of the clauses that you typically get in the contract is literally what that's for. There is a standard, obviously, there's a COSO framework within it. So there's things like, the company's policies. Do they have the policies? Do they follow the policies? Yes, we have a password policy. Do we let everybody create their own passwords and let them be weak, right? And so you'll have that the policy's created and that what's in that policy is followed, but it gives you kind of a lens into the kitchen, right? Is it the actual letter grade by the health agency to say this restaurant's an A+ in terms of cleanliness? No, it is not, right? It is the understanding of, they let you into the kitchen. And then you can say whether you like the fact that, we're using these firewalls or this vulnerability scanner or this change management schema, or these individuals are given access to your data, and this is the questions we ask them in terms of background checks before they get access, right? And if the answers aren't satisfactory to your own understanding, it's probably because you didn't interpret that as a benchmark properly, right? It is not a benchmark. It is a way to have addressed all the controls, validate them by third party, and then you can decide whether they've met your own benchmark in terms of performing to task.
Mm-hmm. Yeah, and I think in the conversation the other day, you had mentioned it's not so much a standard, it's not like a checkbox, although it's critically important because it is an indication of trust. Is this organization that you're looking to work with, do they take security seriously, if you will?
Yeah, so, and I will make one more comment very quickly about the check. It is a necessity for those who want to maintain their SOC 2 compliance.
True.
That if there's organizations underneath them that are not SOC 2 compliant, that subservice organization now has a problem, right? So when you think about cascading this dependency, just like GDPR, right? You want to be, saying that you're meeting GDPR compliance, but you use an organization that does not follow those rules, you're in violation, right? So it is a checkbox for those that already have a SOC 2 to maintain a SOC 2. It absolutely is. It's literally in financial services why we do this for those customers. But it also gives a lens to others to say, hey, look through and see what we're doing. And then we can teach you how to interpret it. And Aaron already wrote, I think, another article about the SOC 2 interpretation of those controls so that you could make it a bit of a benchmark and say, what am I supposed to look for in this report that tells me whether you guys are good or bad?
Yeah, that's correct. And that is available on the website for anyone who's looking for that. Now, one final question I have for you before we go and check and see if there's any audience questions is, what are some of those policies and process that healthcare organizations can put in place to ensure at least a level of due diligence on third-party vendors?
Yeah, I think that first you have to look at auditing your supply chain in terms of software providers. Who's networked to you? Who has your data? What are critical to your operations, right? You may not recognize the person that's going to hit you next. I mean, if you look at over the past several quarters, the more ubiquitous a particular piece of software is, whether it was Confluence Atlassian that got hit in late November, or Kaseya SolarWinds earlier in the year through 2021, right? Other vendors like Exchange, right? Hafnium Group exposing a lot of vulnerabilities there and compromising not just data but networks as well. You look at that and say, okay, well, it's likely going to be the the big popular used by everybody vendors, because they're trying to maximize output. I mean, one hit by DarkSide against Colonial Pipeline might net them $5 million, but their Bitcoin wallets are full of $90 million worth of it because they hit 2,200 other organizations with the same attack, right? And so in order to maximize their gains, they lather, rinse, they try to be efficient just like every other organization, right? They want to go out and say, well, what's the broadest way that we can keep hitting people, exchange, 125,000 people hit by that particular attack. So it's really for practical advice to audit your supply chain people. And then the procedure there is give them as little access and as little, capability as possible, right? If the marketing department needs something, right, give it just to the marketing department, segment it off from everything else that can happen on their workstation and laterally to the network, so that if that particular group now introduces a new piece of software that happens to be used by that group, but in every group across the world in those organizations, they tend to have that same software, very likely that that's a target, right? Very likely that that's an entry point to your user data or something that you would pay money to get back, right? Or to have deleted or not known that it's gone out, or frankly, to keep your operation up and running. So, I think that when you audit those suppliers, keep those in mind in terms of how you calibrate the priority, but also look at segmenting them, cutting off access, removing, containing, limiting, separate credentials, those kinds of things that just make sure that, for convenience, they're not just one flat network, all the credentials, everybody can get everywhere.
Yeah.
And knowing the incident.
Yeah. And I think before you had mentioned as well, pen tests. You don't necessarily just do a pen test on yourself, but you can actually do them on your suppliers and vendors.
Yeah, those suppliers, I mean, when you go through vendor due diligence, there's just so much that you collect about them that, may not necessarily give you. We just talked about the SOC 2. Everybody collects a SOC 2 about their vendors, right? It's almost like a litmus test to see if you've gone through the rigor of auditing yourself at all and paying money to do so that you can say, okay, is this an actually investment from the company? Some people just use it as a shortcut for that capability, right? As you go to the other vendors, right, and the other vendor due diligence questions, so much of it is, have you gotten other compliance standards like ISO or others? And now you're just duplicating effort, right? Now you're just saying, okay, well, if you've gone through ISO and you've gone through PCI, well, you've probably reviewed the exact same controls with different, headers on them for different types of data. And so you're not getting much more bang for your buck. You get to the pen test question, and most people just sort of turn back and go, well, our last one was last year. That's really the probably single greatest indicator that when you go through that exercise that you have an up-to-date. Like we internally test ourselves virtually every month, right? But when you look at, even internally with our security engineering team, they're testing constantly whether the software we use to protect ourselves every 24 hours is actually going to be able to do the job, right? That's how often we do it, right? When you look at somebody that's doing a formal third-party penetration test and they're designing these structures, you're getting a lot of different things, right? Controls tests, red team tests, some sort of exploitative vulnerability scan. And those tests, right, the ones that you can do yourselves, right? You can do that to a third party. You can go get a fairly cheap service provider that's going to let you scan any public IP and say, okay, go ahead. If you're outsourcing this one app in Azure, go ahead and scan it. Do your own pen test if they don't have the answers for you. You shouldn't be afraid to say, you know what, guys, these are non-starter questions. So it's usually the sales team that's going to kind of push back and say, do we really need to have this? Should we do this for this customer? And the truth is that you as a vendor should be confident to just say, yeah, no, we can do our own pen test on you, or we can ask our own questionnaire then. And it's our due diligence. It's our risk that we're taking alongside you. Let us prove it to ourselves.
Perfect. I appreciate all that input. I know it's an overwhelming amount of information for everyone, but this is on record, so you can listen to it twice to make sure you capture all of Adam's great insight. Now, as promised, we did leave a little time left for a couple of audience questions, so I'm going to check our side panel. Okay, so we do have two questions in, Adam. The first one is, one of our existing partners has lax cybersecurity. We are under a contract for 2 more years. How do we get them on board?
Yeah, I mean, segment, right? The hygiene of your partners is your hygiene. And so if you add up all that hygiene, you conceptually understand what your security posture is. The only way is to segment, is to remove access, capabilities, the environment from your own internal data stores or your own credential systems or your own network, right? The attack on somebody like Actelion was only even a problem because they had all the data for those customers downstream. If they weren't using that for file storage, if they weren't doing it on-prem, then an attack on Actelion doesn't really mean anything to you, right? Not from a data loss perspective. If you then say, okay, well, I can't segment them in terms of my data. Are you letting them? What records are you keeping in there, right? Most people don't prune anything. If I think about Salesforce, it's a great example. How many of the companies that use Salesforce maintain the entirety of all their customer records up there? And for a long time, and probably more, right? Probably special invoicing instructions, invoices themselves, all kinds of other things that probably you wouldn't even consider necessarily sensitive data outside the PII. But then others that just sort of never prune it, right? It's always up there. And so the concept is that, you should be segmenting not just what they can access and who accesses it and how broadly they can take down your network. You should be pruning the amount of data, like bring it offline, right? Export it, archive it, prune it. And if you only need 30 days of it, that's all you need, right? We used to have this joke in IT about Windows 2003. We said, turn it off and wait to see who comes to your door, just to see, when you actually need it. If you don't watch that show, Marie Kondo, where, if it doesn't bring you joy and you're not actively using it, then, you probably toss it to the side. So that, as well as obviously segmenting everything from the network, keeping them very far away from everything else.
Yeah, I think that same principle applies to admin rights, access rights as well. Turn them off. I mean, limit that and also turn it off. If someone really needs it, they'll come and you can prove that business case at that point in time.
But that's how you bring the 2-year-old vendor in. That's how you bring the too much data in. That's how you do it. Yeah. That's the compromise you give them. Okay, if you don't have the right security protocols, and really even if you do, you're going to get nothing more than you need access to, and that's it.
Yeah, exactly. Now we do have a few other questions, but I think we have time for one. So I am going to grab this one. Interesting points on mobile devices. Should MDM, so mobile device management, or MTD, which would be mobile threat defense, be a mandatory checkbox on an RFP?
Well, it depends if your devices are issued, right? You're likely going to have in some form or fashion MDM, right? I don't know that you even need to say it. It's mostly that if you're procuring something, there is only one controller of those devices, right? And so depending on the relationship, sometimes it's a terminal that's given to a physician that's really managed by another vendor. And so, you're not necessarily going to get the management over top of the vendor that's going to own that management. So there's a bit of competing management going on in those mobile devices. So I wouldn't put a tick box if it's that relationship. If you don't own the device, I think it's unrealistic, given a lot of the way that privacy is going, to try to manage users' devices that you don't own. I think it's completely unrealistic to say we'll give you a stipend for a cell phone, and then outside of a container, we're going to manage all the things on your device now, and we're going to be able to wipe it and back up your wedding photos. That's unrealistic. What I do think is the new world is that we can now recognize that mobile devices are definitely getting attacked, right? And I think that the smishing campaigns, you see T-Mobile recently saying, millions of unpreventable smishing attacks happening, and everybody's familiar with the text message they get from not their bank asking them to click on something, and it happens constantly, right? And so what happens if they do click it? What is actually compromised? I think for a long time in mobile, people used to say to themselves, you know what, it's a single user space. An attack on one app or embedding of a Trojan in an app has no effect on my messages and my content and my corporate apps that have the data local to the operating system and credentials to the clouds, right? And I think that that's false, right? You look at these attacks and you'd say, okay, these are beachheads to steal two-factor tokens. These are beachheads to take data. And if you don't have MTD, mobile threat detection, enabled for those devices, then you are at risk, and a risk you're not even calculating. I think this is a place that most people just sort of say, it's personal and we only have MDM at our disposal, so we should walk away from the relationship. And I am saying that you shouldn't use MDM for personal devices, because that's not the type of relationship you need with your employees or staff or contractors. But MTD, I think there's very little argument that you shouldn't be running that. If you're going to interact with corporate apps, we're going to enable your mobile phone, and we did put a container there. I think it's a reasonable thing to say we're also going to sponsor you getting mobile threat detection enabled, so that at least when their apps are compromised, we can say, okay, I'm sorry, you've been compromised through whatever Angry Birds crack you decided to download. We have to take away your containerization until your device is cleaned, right? And so it's really no longer about posture assessment. It's way more than that. I think we have the knowledge and the skills now to do that in the cyberspace, and we should do that.
Yeah. Oh, thank you. So as usual, our time has passed way too quickly. Thanks, Adam, for being here again today. Thank you, the audience, for sticking with us and asking questions. If we didn't get to all of them, and I think there may be a couple there, we will record those, we'll answer them, and we will get those answers out to the audience. And don't forget to provide your feedback. I hope you learned a little bit more today about how ActZero can help your healthcare organization cover more ground in your journey to securing your business. Until next time, thank you.